My name is Laura Reber. I'm a school psychologist, and I'm the founder of Progress Parade, an online special education tutoring company and educational therapy company. So one of the main questions we get from our parents is, what is educational therapy? So that's really the purpose of this video. Many people have first heard the term educational therapy maybe when reading about what to do for their student with particular or diverse learning needs. Maybe they heard a parent or teacher mention educational therapy, and just a lot of people sort of immediately resonate with that word. Like, hey, I know my student needs something specialized with their educational needs, so I'm just really curious about that. So if that's why you're here, then you're in the perfect spot. So first of all, I want to break down what is educational therapy, and how is it different from traditional tutoring? So many people out there think of educational therapy and tutoring as two completely separate or different things. That's not how we think of it here at Progress Parade. And to kind of help you understand how we think about it, I'm going to use a quick analogy here with doctors. So if I have a cough, usually the first person I'm going to go see is my general practitioner. Maybe they'll take my temperature, maybe they'll look in my ears, look in my throat, take my heart rate, listen to me breathe. They'll do all the kind of basic stuff that they can do to kind of screen for something that they might know about. Now in that process, maybe they'll see something in my sinuses or something when they're looking down my throat that says, you know what, hey, this is not my specialty. I think you should really see a specialist for sinuses. And then maybe they'll refer me to an ear, nose, and throat doctor or some other relevant specialist. That's really how I think of general tutors in relationship with educational therapists. So a general tutor is a great kind of first line of defense if your student is having academic challenges. If you've tried general tutoring, or if your student has had diagnoses of learning disabilities or anxiety or executive functioning challenges, that's when it's kind of time probably for that next line of defense or for that specialist to meet your student where they're at. So I think it kind of helps to think of them as sort of a continuum or related to one another in the same way that we think of many specialists who help meet our needs. And then another really common question is, what is the background of an educational therapist? This is a pretty tricky question to answer because there's no one-size-fits-all approach. You definitely want to find an educational therapist who has degrees in education and who is a professional educator. Beyond that, that's necessary but not sufficient, as they say. Beyond that, you definitely want to have an educator who has training in both academics and social emotional learning. So definitely want somebody who has training and experience in both the academic side and also how the social emotional needs relate to academic needs and how both needs really need to be met. Beyond that, you also want to make sure that the background of the specific educational therapist that you're working with is going to match the needs of your student. So if your student has learning disability, then you're going to want to find an educational therapist who has specific trainings, specific experience in that student's learning disability, in that student's grade level. Same thing for something like executive functioning. I wouldn't want to go, for example, to a multisensory Orton-Gillingham tutor if I have executive functioning challenges. I would want to find an executive functioning coach that knows my grade level, knows my developmental level, so that they can really individualize the instruction to my needs. So definitely need to find the right fit all around. If that's daunting for you, then that's exactly why we're here at Progress Parade. We really do specialize and put a lot of attention on making that right match. So we have a whole team of educational therapists and specialized tutors so that we can do that intake call with you, learn about your student, and then make that perfect match. So I know I've said a lot about educational therapy, but I still haven't said, what is educational therapy? I've given you kind of a lot of background. Again, kind of like the background of an educational therapist, it is a pretty hard question to answer. There's no like one size fits all answer for what is educational therapy. It's important to understand kind of some different examples. So that's what I'm going to talk about right now. So one example of educational therapy would be specialized methods in teaching a student to read. So a tutor who has background in Orton-Gillingham or Wilson, those are both multisensory methods for reading. They're really specialized. They're specifically designed for students who maybe haven't responded to traditional phonics style reading instruction. They are still phonics based, but they have some multisensory components in addition that really can help students respond that need that extra level of support and who need a new way of learning to read. So that's one example. Multisensory math can also be really effective for students that might struggle with the math side. So something like touch math is also a specialized method. So yeah, having specialties and kind of those learning disabilities is one example of educational therapy. Executive functioning coaching and homework coaching. So in traditional tutoring, maybe we would just go over your students' assignments and make sure they know how to do the assignments, answer any homework questions they have. In educational therapy, we're going to be looking beyond that. How can we help your student, learn how to do their homework themselves over time? Like, what kind of skills can we teach them so that they know how to find what homework they need to do, so that they know how to ask the right questions, so that they're able to make their own organization systems and make their own plans, do long-term planning, plan for long-term projects. We really want to teach them the skills beyond just what's needed in that moment to help them become more independent over time with executive functioning skills. A big thing that's also part of part of educational therapy, is creativity. So, in traditional tutoring, we might have a bag of tricks that we turn to. In educational therapy, that since educational therapists do have that additional training, background, and expertise, they're going to have a much bigger bag of tricks to pull from. So if, the first, second, and third way that we try presenting a piece of information to a student doesn't click, then we're going to keep trying until we find something that clicks for that student. And creativity is such an integral part of educational therapy because we really do want to connect with your student and meet him or her where they're at. So yeah, that's a lot of kind of components of educational therapy. Also, a big part of educational therapy almost always is building a student's self-confidence and reducing anxiety. Students who come to educational therapy often have a long history of just hearing that, they're in the lowest reading group, or hearing messages like that, you're not good at that, or you tried and are still struggling, or, just a lot of negative messages around school. Even if nobody is saying anything overtly to them, they're getting messaging from their grades or from different feedback or from just looking around them and seeing how their peers are doing. So a lot of times their self-confidence can take a big hit from that. So part of educational therapy is really helping them build back that self-confidence, helping them become more resilient, helping them see the progress over time, how they really can turn learning challenges into life-changing achievements, and then having that build their confidence to tackle future educational challenges and future life challenges. So also a lot of our students do have anxiety around learning, so we can definitely build in tactics to help reduce that anxiety and help build their confidence in themselves and help kind of overcome all the self-doubt that they might have around school. So those are some popular components of educational therapy. If I had to kind of boil it down in a couple sentences, I think I would say educational therapy is turning learning challenges into life-changing achievements. That's one of our slogans here at Progress Parade, and we 1000% believe that that's possible, and it guides everything that we do here in our company. So just a quick thing on what educational therapy is not. Educational therapy is not counseling or therapy, mental health therapy. A lot of our students do participate in counseling. They do work with a psychologist or social worker on their mental health needs. Definitely are pro getting the help that you need for mental health. And, we work closely with a lot of therapists and counselors. So if your student is seeing a therapist or counselor, we would love to collaborate with them. Like if they're having anxiety or their techniques they're learning in therapy, that we can help them practice during educational therapy sessions. But yeah, we're not providing therapy directly. If your student has significant mental health concerns, then we would encourage you to continue with therapy appointments and counseling appointments in conjunction with educational therapy. So I hope this video has been helpful. We kind of talked about how educational therapy is different to and similar to traditional tutoring, the background of educational therapists, what is educational therapy, what educational therapy is not, and kind of just gave you a brief overview. So we'll be having more videos soon on additional topics related to educational therapy and special education tutoring, and I hope you'll join me for those too.